Good morning, everyone. Thank you for being here today. I'm excited to kick off our presentation on mobility and immobility. Today, we'll explore how movement impacts health and well-being and what happens when mobility is compromised. We'll cover key concepts, different conditions, and strategies for care. Let's get started. Mobility is really about the ability to move freely and easily through our daily activities. When we talk about mobility, we're referring to how comfortably and independently someone can get around. On the other hand, immobility is quite the opposite. It means being unable to move freely, which can lead to a range of physical and psychological issues. For example, when movement is restricted, it can cause muscle weakness, joint problems, and even affect mental health, leading to feelings of frustration or depression. Maintaining mobility is absolutely essential for overall health because it helps us stay active, independent, and engaged with life. It supports our well-being and allows us to perform everyday tasks without assistance. So, in this presentation, we're emphasizing that preserving mobility isn't just about physical movement, it's about maintaining our quality of life and independence. Let's take a closer look at the elements of normal movement. First, alignment and posture are fundamental. They involve positioning our body parts correctly to minimize strain and prevent injury. Good posture supports overall movement efficiency and comfort. Next is joint mobility, which is the ability of our joints to move freely through their full range of motion. This flexibility is key to performing daily activities smoothly and safely. Then we have balance. This is about the even distribution of weight, which helps us stay stable whether we're standing still or moving. Finally, coordinated movement involves the seamless functioning of our muscles and nerves working together. When these elements come together harmoniously, they enable us to move naturally and efficiently. These components are essential because they form the foundation for healthy, normal movement, which is a core theme in understanding overall mobility and injury prevention. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about the principles of body mechanics, which are essential for safe and effective movement. First, maintain a wide base of support. That means keeping your feet shoulder-width apart to help balance and stabilize your body. Next, always keep your back straight. When you need to bend, do so at the knees, not at the waist, to avoid putting strain on your lower back. When lifting objects, hold them close to your body. This reduces the strain on your back and makes lifting easier. It's also important to avoid twisting your body or making sudden movements, as these can lead to injuries. Instead, aim for smooth, controlled motions. And remember, use your strongest muscles, like your legs and hips, for lifting and moving. Engaging these larger muscle groups helps protect your back and makes the task safer. These principles are key to maintaining good body mechanics and preventing injuries in everyday activities and the workplace. Let's take a closer look at some of the key factors that influence body alignment and activity. First, growth and development play a significant role because as our bodies grow, they change shape and structure, which can affect how we align ourselves and move naturally. Next, physical health and illness are crucial. When we're healthy, our bodies tend to function optimally, but illness or injury can disrupt our alignment and limit activity. Mental health also impacts our posture and movement. Stress or emotional strain can cause tension in muscles, leading to misalignment. Nutrition is another vital factor. Proper nourishment provides the energy and building blocks our bodies need to maintain good posture and strength. Personal habits, like how we sit, stand, or carry ourselves daily, directly influence our body alignment over time. Fatigue and pain are also important. When we're tired or in pain, our muscles tend to compensate, which can lead to poor posture and imbalanced activity. Overall, understanding these factors helps us maintain better body alignment and supports healthier, more active lifestyles. Now, let's take a closer look at the different types of exercise and their benefits. First, we have isotonic exercises, which involve muscle contraction combined with movement. Think of activities like walking or running. These help improve muscle strength and endurance while also boosting your cardiovascular health. Next, there are isometric exercises, where the muscles generate tension, but there's no movement involved. An example would be holding a plank position. These are great for building strength without putting strain on your joints. Then, we have isokinetic exercises, which involve resistance training at a constant speed, often requiring specialized equipment. These types of exercises are excellent for targeted muscle strengthening and rehabilitation. Now, moving on to the benefits of incorporating these exercises into your routine. Regular exercise improves circulation, which means better oxygen and nutrient delivery throughout your body. It also enhances overall strength and coordination, helping you perform daily tasks more efficiently. Beyond the physical, exercise positively impacts your mental health by reducing stress and improving mood, and it also increases flexibility, making movement easier and more comfortable. Importantly, staying active helps maintain bone density and joint mobility, which are crucial as we age. When we think about overall health, these benefits contribute to a higher quality of life and a more resilient body. So, integrating different types of exercise isn't just about staying fit, it's about supporting your body's overall well-being. Today, I want to talk about isotonic exercise, which is a fundamental concept in understanding physical activity and muscle function. Essentially, isotonic exercises involve movements where the muscle length changes while the muscle contracts, producing movement at a joint. Think of activities like lifting weights, doing push-ups, or even walking. These are all examples of isotonic movements. The key point here is that during isotonic exercises, your muscles contract against a constant resistance, leading to movement of the limbs or other body parts. This type of exercise is important because it helps improve muscle strength and endurance, and it also enhances joint flexibility. Connecting this to our overall theme, isotonic exercises play a crucial role in maintaining functional fitness and supporting daily activities. They are often recommended in rehab and general fitness routines because of their effectiveness in mimicking natural movements. So, when considering exercise programs, incorporating isotonic movements can be highly beneficial for overall health and mobility. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at isokinetic exercise. This type of exercise is quite unique because it involves muscle contractions performed at a constant speed throughout the movement. The key point here is that the resistance adjusts automatically to match the force you apply, which allows for a controlled and safe workout. This means the equipment used, often called an isokinetic dynamometer, provides resistance that adapts in real time, ensuring you're working your muscles through their full range of motion without risking overstretching or injury. One of the most important benefits of isokinetic exercise is that it allows for maximum muscle engagement while minimizing stress on the joints. This makes it especially valuable in rehabilitation settings or for athletes recovering from injury. Connecting this to our overall theme, isokinetic exercises are a powerful tool because they combine controlled resistance with safe, effective muscle strengthening. They help improve muscular strength and endurance in a very precise way, which aligns perfectly with our goal of optimizing functional recovery and performance. Let's take a closer look at the effects of immobility on the body. When a person is immobile for extended periods, one of the key areas affected is the musculoskeletal system. You might notice muscle atrophy, which is the wasting away of muscle tissue, and joint stiffness that can limit movement and flexibility. Moving on to the cardiovascular system, immobility can lead to orthostatic hypotension, a sudden drop in blood pressure when standing up, which can cause dizziness. There's also a risk of thrombus formation or blood clots, especially in the legs, which can be dangerous if they travel elsewhere. In terms of respiratory effects, decreased lung expansion is common, meaning the lungs don't fully inflate, which increases the risk of pneumonia. This is because the usual deep breathing is reduced when movement is limited. Gastrointestinal issues such as constipation are also prevalent, as immobility slows down digestion and reduces bowel movements. The urinary system isn't spared either. Urine stasis or stagnation can occur, leading to infections like urinary tract infections. In the skin, pressure ulcers, also known as bed sores, can develop from prolonged pressure on certain areas, especially over bony prominences. On a psychological level, immobility can contribute to feelings of depression and anxiety, impacting overall mental health and well-being. All these effects highlight how vital mobility is for maintaining overall health, and they underscore why early intervention and mobility promotion are so important in patient care. Let's talk about the importance of maintaining normal body alignment and activity. Encouraging regular movement is key because staying active helps keep our muscles strong and flexible, which supports overall health. It's also essential to maintain good posture and ergonomics, especially when sitting or working for long periods, to prevent strain and discomfort. Using assistive devices, when needed, can really make a difference in maintaining proper alignment and ensuring safety. Lastly, creating a safe environment by keeping pathways clear and ensuring proper lighting helps prevent falls and accidents. All these steps are interconnected and vital in supporting mobility and independence, which ties into our overall goal of promoting health and well-being. Now, let's talk about alterations in body alignment and mobility. These changes can happen for various reasons, including injury, disease, pain, or neuromuscular disorders. When these factors come into play, they can lead to poor posture, which not only affects appearance but can also cause discomfort and further complications. You might also notice reduced muscle strength and a limited range of motion, making it harder for patients to perform daily activities. As nurses, it's crucial that we assess these changes carefully. By doing so, we can identify early signs of potential problems and intervene appropriately. Preventing complications is a core part of our role, so understanding these alterations helps us provide better care and support to our patients. Remember, maintaining proper body alignment and mobility isn't just about comfort, it's about overall health and preventing long-term issues. Now, let's talk about nursing interventions for impaired mobility. First, assessment is key. I want to emphasize the importance of observing the patient's gait, their balance, muscle strength, and range of motion. These observations help us understand the severity of impairment and guide our care plan. Moving on to interventions, encouraging activity and exercise is crucial. Even small movements can make a big difference in maintaining muscle tone and joint flexibility. Using assistive devices like walkers or canes can also promote safety and independence. Proper body mechanics are essential, both for the patient and the caregiver, to prevent strain and injury. And of course, we need to be vigilant about preventing complications such as pressure sores and contractures by turning patients regularly and providing proper positioning. All of these interventions tie into our overall goal: promoting mobility, preventing further decline, and enhancing the patient's quality of life. Let's talk about range of motion exercises today. These are important for maintaining joint flexibility and overall mobility. First, we have active ROM, which is performed by the patient themselves. This means the patient moves their joints through their full range without assistance. It's a great way to keep muscles active and prevent stiffness. Next is passive ROM, where the nurse or caregiver moves the patient's joints for them. This is especially helpful if the patient isn't able to move on their own. Then we have active assistive ROM, which is a bit of both, done with the patient helping as much as they can and the caregiver assisting as needed. The key benefits of these exercises are quite significant. They help prevent stiffness, which is common when movement is limited. They also improve flexibility, making daily movements easier. Additionally, ROM exercises enhance circulation, which is vital for healing and overall health. Incorporating these exercises into patient care can really support recovery and mobility, fitting into our overall goal of promoting patient independence and well-being. Let's talk about active ROM, or active range of motion. This is a key concept because it reflects how well a patient can move their joints through their own muscle effort. Essentially, it shows the functional ability of the muscles and joints without any assistance. When assessing active ROM, we're looking at how much movement a person can achieve on their own, which helps us understand their strength, flexibility, and overall joint health. Importantly, it also gives us clues about potential issues like muscle weakness or joint stiffness. In the context of our overall theme, restoring mobility and function, active ROM is a fundamental measure. It guides us in developing effective treatment plans and tracking progress over time. Remember, improving active ROM is often a primary goal because it directly impacts daily activities and quality of life. Let's talk about passive ROM, or passive range of motion. This is an important concept because it involves moving a joint through its range without the patient actively using their muscles. Essentially, it's the therapist or examiner doing the movement for them. Passive ROM helps us assess the joint's flexibility and the integrity of the surrounding tissues, like ligaments, tendons, and muscles. It also provides insight into limitations caused by pain, swelling, or structural issues. One key point is that passive ROM is different from active ROM, where the patient moves the joint themselves. Passive movements are especially useful when a patient can't actively move a joint due to weakness, paralysis, or pain. In our overall theme of rehabilitation and assessment, passive ROM is a foundational tool. It helps us determine the baseline joint mobility and guides us in developing effective treatment plans. Remember, maintaining or improving passive ROM can prevent contractures and joint stiffness, which are common concerns in many conditions. Let's talk about muscle strengthening exercises. One key type is isometric exercises, where you tighten your muscles without any movement. It might sound simple, but it's a very effective way to build strength, especially if movement is limited. Then we have resistance exercises, which involve using weights or resistance bands to challenge your muscles. These are great for improving overall muscle tone and endurance. The main goal here is to help maintain muscle tone and prevent atrophy, which is the wasting away of muscle tissue. Incorporating these exercises into your routine supports your overall health and mobility and connects directly to our theme of maintaining independence and strength as we age. Let's talk about maintaining proper body alignment, which is essential for both comfort and safety. First, we have different positions to consider. Fowler's position involves elevating the head between 45 and 60 degrees, which helps with breathing and alertness. Supine means lying flat on your back, a common resting position. Prone is lying face down, useful for certain assessments or treatments. Lateral is side lying, often used for comfort or specific medical needs. Sim's position is semi-prone, where you lie on your side with one leg flexed, providing good access for procedures. Lastly, Trendelenburg involves tilting the patient so that the head is lower than the feet, which can be helpful in specific clinical situations. Now, moving on to movement techniques. It's crucial to always use correct body mechanics when moving, lifting, transferring, or walking. This means positioning yourself properly, engaging your core, and avoiding unnecessary strain. Proper technique not only protects your body, but also ensures the safety and comfort of the person you're assisting. Remember, maintaining good alignment and using the right movement methods are key components of safe patient handling and overall care. They connect directly to our goal of providing safe, effective, and compassionate care to everyone we serve. When assisting clients with ambulation, the first step is to assess the patient's strength and balance. This helps us understand their capabilities and any potential risks. It's crucial to determine how much support they need to move safely. Next, always use gait belts or walkers to ensure safety during movement. These tools provide stability and help prevent falls. When positioning yourself, stand on the patient's weaker side. This gives them more support and control. As they walk, encourage slow, steady movements. Rushing can increase the risk of imbalance or falls. Remember to provide rest periods as needed, because fatigue can compromise safety and effectiveness. Overall, these steps are vital in promoting safe, confident ambulation, aligning with our goal of supporting independence while ensuring safety. Now, let's talk about caring for patients with immobility using a nursing process approach. First, assessment is crucial. This means observing both the physical and emotional conditions of the patient. Noticing changes or signs of discomfort helps guide the next steps. Next comes diagnosis, where we identify potential issues like the risk for disuse syndrome or impaired physical mobility. Recognizing these risks early allows us to plan effectively. In the planning phase, we set realistic mobility goals. These goals should be achievable and tailored to each patient's condition, helping to motivate progress and ensure safety. Implementation involves practical interventions such as range of motion exercises, repositioning to prevent pressure injuries, and maintaining good hygiene care. These actions are vital in promoting comfort and preventing complications. Finally, evaluation is about monitoring the patient's improvement in mobility and overall comfort. Regular assessment helps us determine if our interventions are working or if adjustments are needed. Remember, this systematic approach ensures comprehensive care, addressing all aspects of a patient's mobility and well-being. Now, let's talk about caring for patients with casts and splints. First, it's essential to assess circulation, movement, and sensation, what we often refer to as CMS. This means checking that blood flow is adequate, the patient can move their fingers or toes, and sensation is intact. These checks help us catch any early signs of complications. Next, keeping the cast dry and clean is crucial. Moisture can cause skin irritation or infection, so ensuring the cast stays dry is part of good care. Elevating the limb is another important step because it helps reduce swelling, which can be uncomfortable and also prevent further complications. We also need to be vigilant for pressure areas, spots where the cast might be too tight, and to report any pain or unusual odors immediately, as these could indicate pressure sores or infection. Finally, patient education is key. Teaching them how to care for their cast and understand mobility precautions empowers them to participate in their recovery safely. Proper care supports healing and helps avoid avoidable setbacks, which ties back to our overall goal of providing safe, effective patient care.